I lead a team at Esri that works with customers and prospects that are called doctors, nurses, social workers. We work with healthcare professionals, we work with public health professionals, and with medical researchers. These folks, in turn, worry every day about illness, disease, premature death, topics that I would have to admit, it's not your typical early GIS adopter crowd. And if some of you have ever attempted to work in that industry, you probably will agree with me. This is a tough audience to bring the promise of GIS. But I have a surprise for you today. But before I spill that surprise, I want to introduce you to some of the folks that I know care deeply about what you and I do with our GIS knowledge and expertise. I'd like to introduce you to babies. They're really newborns, but if you think about it, these newborns don't get a chance to have any say in where they're going to be born. In fact, they get no choice as to the quality of the air they're going to breathe, or what kinds of quality of the food or the beverages that they're going to consume. In fact, I would argue that a baby's best chance in this world for a healthful and productive life is us. And of course, we always hope that all our babies will grow up to be children. Not all of them get to do that. The child's body and mind struggle every day to cope in an environment that we have really created for them. So in some ways, we who sit in this room are ultimately responsible in some small way for creating the world that they must live in. And of course, there's us, the adults. We get to make lots of choices in our life. Some of us get to choose where we live. We get to choose the foods and the beverages that we drink. But ultimately, we're also captive of the environments in which we live. Some of us do well in handling those kinds of environments, and some of us don't do so well, as pictured here. In my view, and in the view of the team that I lead, we believe the benefits of the promise of this GIS have to come to all these people. Not just a few, but to all of them. So in our view, place is really important to all these people. It is probably the bedrock upon which society will either make great progress and move forward or not. If I were to tell you that these problems exist all over the world, you probably already get this. You read your newspaper every day, you realize there's no shortage of these kinds of human trauma that are playing out all over the world. But if I were to suggest to you that there's 130 million people that will die in the next 12 months for conditions that we already know how to prevent, and if I told you a third of those were children under 5 years of age, doesn't that make you want to do something? I know it does for me. Well, here's my secret. The health market is positioned to grow. My evidence is that 119 out of the 192 national health ministries in the world have already acquired some type of Esri technology. All 50 states in the United States have acquired it. Many social service agencies have acquired it. So what's the problem? Well, one of the problems is they don't know how to use it that efficiently. And you can see this map that shows you all the countries that have already acquired this technology. In fact, in the last decade, they've acquired over $200 million of Esri technology in the health and human service market. That's not an insignificant amount. So if you're wondering why they're struggling with it, I'm going to give you 4 good examples of things that they need to do, and they need your help to do it. First of all, they must begin to move to a much more focused approach in their work. They must move from broad data and the revelations that that brings to much more focused kinds of applications. They also must draw in more health-seeking consumers, because we've got to get to people before they get ill and before they get diseases and before they run into problems that will affect their life. And so they need to learn how to move from the very complex to what I call the simple, the consumer approach as to how to consume this information. They also have to move from an era where they begin to look at the basic reporting processes and workflows that they have into building systems where they accelerate the intervention that needs to take place. They need desperate help in these areas. They also must learn to be more efficient. They must learn how to move from paper to computer. You've been to the doctor's office, you've been in the healthcare environment, you know that this is a major issue before really the world, of how to rid it of the paper and the confusion that paper has caused. And lastly, they must learn how to deal with accountability. This is a headline from someplace here in the United States, where a social service agency lost 1,000 children overnight. They didn't know where they were. So suddenly we now see the need that they must step up this race to accountability. So what I'd like to say to you today is, why does Bill Davenhall and his team get up every day and go to work at ESRI or go to the airport? It's because we feel compelled to deliver on the promise of this great technology and the minds that are in this room to serve the people that I've shown you here today. So I invite you to devote some of your time and talent, your creative GIS ingenuity, into the health and human service space in order to help me help you help them.